It's like an old homecoming. So thank you. And I think since it's a small group, we can make this more informal. I've got a lot of PowerPoint slides, but at any time, just interrupt, and I know some of you will, but feel free to, so we can make it a little bit more of a conversational thing. But first thing I'd just like to ask you, like how many of you, just raising your hands, think that medicine today has become very depersonalized? Depersonalized, but the human side to medicine is lacking. Yeah. And I think every time I ask that at different places around the world, the hands go up, and it was sort of a universal expression of what's going on in medicine today. And so partly of what we're going to be talking about is an attempt to bring back the personal side to medicine. So here's a short history. Always good to start with history. You know, I have an earache in 2000 BC. They would say, "Here, eat this root." Then 1,000 years later, "That root is heathen, say this prayer." 1850, "That prayer is superstition, drink this potion." 1940, "That potion is snake oil, swallow this pill." 1985, "That pill is ineffective, take this antibiotic." 2009, "That antibiotic is artificial, here, eat this root." And we see how things come back full circle. And some people out there are now bringing it back to the snake oil side, so we're into 2012. So. And if we look at, you know, some of the eras of medicine, you know, we go back to the sort of the horse and buggy doctor, where the doctor was part of the community. He knew the family. He would make house calls. That's sort of alternative medicine today. He would, you know, diagnose and give support, but didn't have a lot else to offer. And a lot of the therapies back then were harmful, like bloodletting, mercury, and unproven. And then at the beginning of the 20th century, we moved into the rise of scientific medicine. There was a great transformation. There was a time of the Flexner Report, and this was over actually at the beginning of Johns Hopkins University when this came through. But the Flexner Report was really saying we would need to introduce science into what we do in medicine. And it moved from this sort of diagnosis and observe that we had before into a diagnosis and treat. And there was a lot of strengths to this. There was a lot of advantages to going this way. There was a development of a lot of wonder drugs, antibiotics, vaccines for diseases like polio, insulin for diabetes, life-threatening surgical techniques, trauma surgery. I'm looking right over at the Shock Trauma Center, right out the window here. Heart valve replacements, even using lab tests, which weren't in the past used before. But there was also another side to this. There was weaknesses because we started to get away from a holistic, whole-person approach to patients, and the doctor-patient relationship suffered. And this approach, that we've taken has worked well for acute disease, but when it comes to many of the chronic diseases that we face on a day-to-day basis, it doesn't have all the answers, as you'll see and probably know already.